My name once again is Toby Adibami. I'm the key account manager for Emzor Vaccines, Lagos. All right, and I will be anchoring this program. Now, our guest speaker is Professor Becky Tagbo. She's a fellow of the Royal Society of Medicine, London, and she's the head of Pediatric Association of Nigeria Advisory Committee on Immunization. All right, she's also a site assessor, a consultant to WHO for the African region. All right, she's an authority when it comes to immunization in Nigeria, and she's going to be sharing with us from our wealth of knowledge and research. So I welcome you all from everywhere that you're joining from. Thank you for joining our webinar today, and I am confident that it will be a body of knowledge that you will appreciate, and then it will be worth your time. Thank you for joining. All right, Professor, we are ready for you.
Good morning, everyone. You are all welcome to this meeting, and we are discussing the impact of a COVID-19 pandemic on vaccination. And starting with the conflict of interest, I actually consult for many organizations and industry, including the World Health Organization at the headquarters, at the African Regional Office, and also at the country office. I consult for UNICEF, for the federal government, the National Primary Healthcare Development Agency, the State Ministry of Health in Enugu, the GSK, the Pfizer, the Emzor, the Sanofi, and so on. So conflicts of interest abound, if you like. This is my outline for this presentation. We'll quickly look at the background of what we are discussing. We'll briefly look at the COVID-19 pandemic, and then the general impact of this pandemic. And then we zero down to its impact on vaccination. And then what has happened lately in terms of its impact on vaccination. We look at the way forward. And I felt that I should just give a word on the vaccine development before I summarize. So by way of introduction, it is not news that vaccine is one of the most greatest, let me say the greatest public health intervention that the world has ever known. And it is not just a potent intervention, it is cost effective. It's actually at such a little cost when you compare it to the life saved. And estimates have shown that vaccine saves 2 to 3 million deaths each year. So you can multiply that by so many years gone now since we started vaccination, and you can imagine how many lives have been saved. Through vaccination, we have achieved eradication, elimination, and control of several diseases. Smallpox has become a thing of the past because of vaccination, and polio is almost gone. Some other diseases have become distant, even though we still have a few cases here and there, like diphtheria, tetanus, pertussis, rubella, and hepatitis B. Realizing that we're in the season of celebrating the hepatitis season. Vaccines are relatively easy to administer, so that makes it even more appealing, and protection is usually long-lasting. But what is vaccination coverage? Vaccination coverage actually refers to the proportion of children or proportion of the people you have vaccinated out of the whole target population. If you are targeting the infants who are less than 1 year, if you have X number of infants in Nigeria and you have vaccinated like half of them, then you will say that your vaccination coverage for that particular antigen is 50%. So it's expressed as a percentage, and it is usually vaccine specific, antigen specific. But globally, what we usually use to measure vaccination coverage is the third dose of the DPT containing vaccine. And in our own environment, that is the pentavalent vaccine. That is Penta 3. And this is the formula. So whatever proportion you have, you multiply by 100 and you get it in percentage. This graph is a WHO UNICEF graph that is showing us the progress that the world has made over the years. So as the vaccination coverage is rising over the years, the number of children who are not vaccinated is dropping. and we have almost reached 90% coverage. However, that still leaves almost 20 million children unvaccinated, and that number is huge. And we have more than 13 million children that have lacked access to vaccination services. But let me also congratulate the federal government of Nigeria, and specifically the executive director and his team at the National Primary Healthcare Development Agency and partners, and in fact, all Nigerians who are partners, for major milestones that we have achieved recently concerning the routine immunization. There was a survey that showed that our coverage was very poor, and the National Primary Healthcare had to take extraordinary measures, to see that we raise our coverage. And in just about 2 years, the coverage has risen from 33% to 67%. And we hope that we'll soon get to our target. And also, last month, WHO has certified us non-endemic for polio. That is another major milestone when it comes to vaccination. What are the determinants of vaccination coverage? We want to highlight these determinants because when anything affects any of these drivers of vaccination coverage, it will cause the coverage to drop. And I just highlighted some of them here. One of them is demand. If people do not demand for vaccination, then they are not going to be vaccinated. And that has to do with awareness, knowledge of vaccination, value of vaccination, confidence, cultural and religious issues, as well as societal influence and people's experiences. The other one is the service. If the service is not readily available for the people, it will also affect coverage, as well as access. Then rumors and adverse events that follow immunization. Most of these adverse events are usually not directly related to the vaccine, but because they happened at the point of vaccination, people think it is the vaccine that caused it. And sometimes it affects the uptake of vaccination. The other one is institutional support or government support. So if any of these factors is affected, the coverage is going to drop. Now, what is the COVID pandemic? The virus is called the SARS-CoV-2 virus. That is severe acute respiratory syndrome coronavirus 2. And the disease is called coronavirus disease 2019. That is COVID-19. And this was first reported in China in December 2019. And then in our country in Lagos in February, where an Italian was affected. As at yesterday, in Nigeria, we have over 32,000 confirmed cases, over 18,000 active cases, more than 13,000 cases discharged, and over 700 deaths. And we have tested more than 180 samples. But I must say that we do not have official figures for children on the NCDC dashboard. And I'm using this opportunity to plead with NCDC to please include children on the dashboard. We need to know what is happening with children, and children should not be left out as far as this COVID pandemic is concerned. And on the WHO dashboard, we can see that more than 12 million affected and over 500,000 deaths already globally. When we talk about the general impact of COVID-19 pandemic on the society, there are so many ramifications. Poverty has increased, as well as unemployment, and we have food shortages, as well as gender-based violence. We also have increased in mental illness and psychological burdens. All of these are not just because of the pandemic itself, but also the mitigation measures, especially the lockdown of various degrees. So the pandemic has brought enormous burdens in terms of mortality, morbidity, economic, social, and educational burdens, emotional burdens, psychological, and these dimensions are still unfolding as the days go by. The pandemic has impacted other diseases as well as child health services. But today we want to focus on vaccination. So what is the impact on vaccination? This is a statement from the World Health Organization, which says that immunization is one of the most powerful fundamental disease prevention tools in the history of public health. And if we disrupt immunization program because of the COVID pandemic, then we are threatening to unwind the decades of progress made against vaccine preventable diseases. And UNICEF also said that we cannot let our fight against one disease, turn the tide against so many other diseases. So we don't focus on one disease at the expense of so many other diseases. The fact that we are fighting COVID, we must not neglect vaccination against other diseases. And the media is full of comments in that light. WHO said that halting immunization coverage will trigger resurgence of diseases. We already have reports of resurgence of diseases like measles. And UNICEF is warning that we should not disrupt immunization services and indeed other health services. People are dying from heart diseases, hypertension and so on, simply because of the effects of COVID mitigation measures. Now, the Global Alliance for Vaccine and Immunization carried out a global survey, and they found that we have disruptions in terms of immunization globally. Several vaccine introduction plans had to be suspended. Several vaccine campaigns had to be suspended. All of these disruptions are as a result of the mitigation measures against the COVID-19. We have fears, we have rumors, we have panic, both genuine and exaggerated. We have deaths from COVID are real, and these are fueling fears. We have the social media effect, which is enormous. Being a new disease, there is lack of awareness, there is ignorance on how to, prevent transmission. The traditional health talks at our vaccination clinics are almost non-existent, and there is diversion of attention, staff, and resources to COVID mitigation. These people are supposed to have been working at immunization points and other health services points, but they have all been moved over to fight COVID-19. And this is affecting all these other health services. And one of the biggest concerns now is the future effect of the COVID-19 vaccine rumors on vaccine confidence. So there is need for proactive push out of positive messages about vaccination in general in health facilities and mainstream media as well as social media, so that we do not have our vaccine confidence wane in the face of COVID-19. We have been taking these vaccines all this while, so people should be encouraged to continue routine immunization. But what is the real picture on ground? We took time to gather some data. First part of the data is from field experts who work in immunization. And from what we got from expert opinions, we have noticed that outreaches, immunization outreaches have been halted, and we have restrictions and a drop in mothers and children turning out for vaccination. In some places, up to 60% or 50% of drop in vaccination. And we're having outbreaks of diseases. We have measles outbreaks, yellow fever outbreaks, of course, because people are no longer vaccinating as part of the issue. Of course, there may be other factors. There is fear, there are rumors, there has been outright rejection of the usual routine vaccination, what mothers have been getting all this while. But based on rumors, some people have rejected some of these vaccines. We have some measures that have been taken by some states During the lockdown, mothers had to be identified and given a pass based on their immunization cards. Some states had to provide special transport for health workers to mitigate against drop in vaccination coverage. And some states had to help to push vaccines down to local governments because of drop in transport. PPEs were provided, and jingles had to be sent out to mitigate against those who were rejecting the routine vaccines. But let's look at some case studies. We looked at some 7 health facilities in the country. And these sites were drawn from the north and southern parts of the country. We took 2 sites from Enugu, a site from Benin, another site from Zaria, 2 sites from Ilori, and 1 site from Oka. And what did we find? What was the impact on the client turnout? That is the clientele. We had reports of initial drop in number of clients because mothers were not aware that clinic was running during the lockdown. Outreach sites were almost completely closed. There was a drastic drop in clientele. One was the fear, the other one was lack of knowledge, the other one was because of high transport costs. There was not awareness. Some mothers were not aware of how the disease was transmitted, and so some of them going for vaccination took along other children who were not even due for immunization, and they were not aware that these children were being exposed. Other mothers thought that services had been suspended. And then there were certain hospitals that were designated as COVID-19 centers. And so some people were afraid that if they went to those facilities, they may, catch the disease. And so that affected turnout. Now, what was the impact on the staff? The staff also had fear of contracting the disease from their clients. They were not trained, they were not aware of how this disease was transmitted and how they could protect themselves. Some of them did not have enough personal protective equipment. Some staff had to be absent because they just felt that they would catch the disease, so they were absent from duty. And in fact, in a particular site, the staff felt that they will not attend to anybody until they had a full PPE with the gown, with the mask and everything. And so that was an issue as well. In terms of institutional and government support, at the time this data was being collected, the staff had not been trained. In fact, most of the training was for those frontline staff who were attending to COVID patients. And so immunization staff were not trained. And so they were ignorant on how to prevent transmission. There was inadequate provision of personal protective equipment. And then attention, staff and resources were diverted to COVID-19 mitigation. But largely, the supplies were not affected. In terms of vaccine supply, it was only sporadic issues here and there. Otherwise, vaccine supply was okay. But what was the challenge in some of these sites? The lack of awareness, lack of training on COVID, lack of PPE and hand washing materials. There was fear among staff and inadequate number of staff to control the crowd. Because you know that at most immunization clinics, it's usually a crowd. And with the distancing matter, you needed more staff to ensure that social distance was observed. What were the best practices we observed in some of these sites? Vehicles were provided to convey staff. Immunization cards were used to identify mothers, and they were allowed by security to pass. And then passes were provided for health workers. And then the particular site where the staff felt that they should not work, management had to intervene and give them information and train them, and so they resumed work. In terms of transmission mitigation measures, they observed social distancing, they used PPEs, they observed hand hygiene for both clients and staff, they modified their method of health talk, and then there was enforcement of wearing of masks by clients and staff. and clients attended to in small numbers. So only a small number were allowed in at a time so that distancing could be observed. Then some sites had to increase their number of sessions. So instead of immunizing twice a week, they had to immunize every day so that smaller numbers came each day. So these were some of the measures that were implemented. Now I want to walk you through the data, the raw data that I obtained from these sites, the total number of children immunized, the drop in total number immunized in 2020 compared to 2019, and then the dropout rate. If you look at this slide, you will see that this is showing the total number of children who were immunized in 2019 compared to 2020 for the 7 sites for January up to June. So the various colors are representing the various months, as you can see. And what you can see almost globally across the sites is that the 2020 levels are less than the 2019 levels, except for one site, that is site 2. For all the other sites, you see that we have less number of children being vaccinated in 2020 compared to 2019, which we are attributing mostly to the COVID-19 pandemic affecting turnout. And also, if you look at 2020 alone, you will also see that over the months that we have dropped, especially starting from March when the lockdown was fully implemented, up to April, and even some of them in May. But what you notice is that for most of the sites, by June, there is already a picking up. So we can actually say that with the easing of the lockdown, with the training, with the measures being put in place, with the awareness, that we are beginning to recover in terms of vaccination. This is showing us the individual sites and the percentage drop in the number immunized in 2020 over 2019. So when the drop is on the positive, it means that you have more people in 2019 than you have in 2020. So for instance, in site 1, you notice that you had a 34% drop in January in 2020 over 2019. So that goes on until you come to March, and then you see a rise. So this rise is showing that you have 43% less number of children immunized in 2020 than in 2019. But we began to improve in June. June, it has dropped to 23%, still bad enough until it gets to 0. It is only when it's at 0 that you know you have equal number in 2020 as in 2019. So the red is showing us that the situation is, there is a major decline. That is the meaning of this red. The yellow is showing us that it's just a mild decline. You can see this is in the negative, meaning that we had more people in 2020 for this vaccine than in 2019, but you can see that it's also dropping. So that is what you see in these other sites. And also here, these sites really didn't do badly at all. They had more people in 2020 than in 2019, except for April and May, when they had just a little drop, and they are back here. So this is the picture as well as site 7. Let me quickly move to dropout rate. Dropout rate is, this is actually the first dose of Penta 1 compared to the third dose of, that is pentavalent vaccine, Penta 1 and Penta 3. We are looking at how many people came in for Penta 1 and how many came for Penta 3. Penta 3 is the third dose. So usually the minimum allowable dropout rate is 10%. That is here. So anything above this is not acceptable. It means that site should be looked into. And so what do we see 2019 and 2020? You can also the color codes showing you which sites did well and which sites did not do well. And again, you can see that for most of the sites, the dropout is higher in 2020 than in 2019. But what we can also see is that by June, we are in June now, you can see that they are recovering. That is what I can say there. So the general observation is that sites don't seem to be interrogating this data consistently. And if they are not interrogating this data, they are not going to be observing these differences so that they can take intervention measures. So, and then we can also conclude that, you know, the COVID pandemic, as well as its mitigation measures, actually affected vaccination and vaccination coverage. And of course, the WHO also came out with some recommendations because a survey was also done globally. But before we look at what WHO came out with, I just included this slide to show us other dimensions that you could have from this COVID-19. It's not just that children are not immunized against specific diseases, but there are other things that could happen. When they are not immunized, you have more children becoming ill. And when more children are ill, they are likely to transmit these diseases to adults. And you're going to have reduced population immunity. And when you have reduced population immunity, the vulnerable population that cannot be immunized are going to be exposed. And you begin to have disease outbreaks. It's going to have economic impact on families and the country because children are ill, they are admitted in hospital, their parents cannot go to work, they cannot farm, and so productivity drops, and that affects the general national GDP. There is also the psychological impact. But there is what we call the non-specific effects of vaccine, which is not necessarily preventing against the disease you have vaccinated. These vaccines can also prevent against other diseases. And I'm going to use 2 slides to show you example with measles. We already have measles outbreak, not just in Nigeria, in other continents, including the Americas and the Europe and the UK. So measles outbreak because vaccination, measles coverage is dropping. So you are having measles outbreak. Now, when somebody suffers measles disease, somebody not immunized, there is what we call immune amnesia. That is memory loss, immune memory. That is the memory of your system against diseases. So when you suffer measles, measles will delete the memory of your immune system against certain diseases. And these are diseases that are not measles, some other diseases. Meaning that if you suffer measles, subsequently you are exposed to other diseases because you've lost your protection against those diseases to which you were previously protected. So measles will induce what they call T and B cell depletion, and this is known as immune amnesia. It will take another 3 years for your immune system to recover that memory against those diseases. Now, this is no longer just the measles itself. So you have long-term memory amnesia. And it's been shown that up to 73% of antibody deposit in your body is lost in people who suffer measles. In some cases, this could actually be found. But this is not observed in vaccinated people. So when we drop in vaccination, people get measles, and they suffer measles, and let's agree that they recover from the complications and they do not die, but they become prone to other diseases apart from measles for another 3 years before they fully recover. So this is just one way of showing you larger impact of the pandemic on vaccination. This is the WHO survey that they carried out. And I mean Gavi together with WHO. And I just wanted to highlight that they showed that Nigeria has the largest number of zero-dose children from conflict. And this shows globally, you know, countries and continents where routine immunization was disrupted. What we can see here is that Nigeria is one of those countries where immunization was disrupted. In some countries, it was totally suspended. This is showing measles surveillance. You see in Nigeria, it is also disrupted. I'll quickly rush through the other slides. They found in their global survey almost similar, the findings are similar to what we found: the lack of awareness, not continuing vaccination, misinformation, disinformation, rumors, and staff being afraid and not coming to work. So what has happened lately? Lately, we have noticed that more personal protective equipment have been provided. We've had trainings now for immunization staff. There is more supervision. Lockdown is being eased. There is increased sessions now, and coverage is beginning to rise. This slide is from the National Primary Healthcare Development Agency, and is showing us vaccination coverage for March, April, and May. And what is the mid drop? Almost across board from March to April. That is showing you that the pandemic is having impact. So what is the way forward? To further mitigate against immunization service disruptions, we should think of doing the following, not necessarily sequentially, but we can do all of them in parallel. We should start our services where we have not started. We should plan for catch-up vaccination activities. We should expand to reach unreached and underserved communities. And then we should have, take some of these COVID-19 funds which are being provided and use it for, infection control adaptation measures, and ensure that we use adaptation and communication to keep track of rumors, deal with the rumors in a robust manner, and adapt our immunization services in such a way that we do not cause any harm. Let us reinforce immunization messages, increase the number of sessions, modify our traditional health talks, train our staff and clients to be COVID compliant as they administer vaccines. We should flood the social media with positive messages, monitor immunization progress, collect data, analyze it, and then act on it. We should counter rumors. I want to refer you to this publication. It was published last month by the Pediatric Association of Nigeria, where you are going to see more details on this topic. And this is also the guideline provided by the World Health Organization on how immunization activities can go on during this pandemic. I will just skip this. This is just highlighting the details of how we can do this. I want to end with a word on the vaccine development, because I know this may be in people's minds. Just to let you know that there are over 260 vaccine candidates currently globally. So people are making frantic efforts to develop vaccines against the COVID-19. And out of that, we already have a number undergoing clinical trials at various stages. So we hope that with time, we're going to be, this is showing us some of the sites. It's all over the world, all over the continent. This vaccine development is going on. It usually takes up to 10 to 15 years to develop a vaccine, but for the COVID, an accelerated method has been devised by the World Scientific Body, but there are questions as to the shortening of the time. These questions are going to be answered by research. So the vaccine we're going to get as a result of shortness of time, we have to ensure the safety, we have to ensure immune response, we have to ensure that it protects and that it does not enhance disease, and then we answer the question of the duration of protection. So I would like to summarize this way, that the COVID-19 has had significant negative impact on vaccination coverage globally and in Nigeria. It has had adverse impact on other health and non-health aspects of life and services. The full impact is still unfolding, and we are yet to know them all. We need a multimodal mitigation measure approach, and this is going to be based on adaptation and communication strategies. we should have a post-COVID-19 plan, you know, in terms of research, monitoring, evaluation, and constant evidence-based adjustment. Above all, we should plan to immunize the global health against disruptions, so that even if we have anything like the Ebola or the COVID, it does not disrupt health services. We want to acknowledge the Pediatric Association of Nigeria, the American Academy of Pediatrics, the International Pediatric Association, and all of these health workers who gave us data to help us put this presentation together. Thank you very much. Over to you.
All right, Prof, thank you. Very, very, very mind-blowing. We appreciate the effort that you have put into coming up with this very educative and instructive slides. And then we have people that have questions, and they've been posting them at the Q&A group. So we'll be taking them one by one, ma'am. Okay.
Yeah.
All right. I know you have access to the question and answer group too, ma'am.
Okay, I'll have to open it.
Yes. Okay, but I'll be reading it out for everybody else to follow. All right. So we'll take the questions. If anybody else asks questions in the next 10 to 15 minutes, we'll be taking your questions and answers. Please put them at the question and answer group. I might not be able to, you know, catch up with the chat because a lot of messages are coming through the chat, but please use the question and answer box to ask your questions. Okay, so the first question, Emma, is somebody, Mr. Michael Ogboefi, is asking that, don't you think community pharmacists in routine?
Sorry, I missed you. I missed you. Can you come again?
I'll take it again. All right. Yeah. So Mr. Michael Ogboefi is asking that, don't you think that the time is right to engage community pharmacists in routine immunization, especially due to the negative impact of COVID-19 pandemic on routine immunization? He said we should remember this pandemic will be with us for some time now. Would you take that?
Thank you for that question. This actually happens in some places, but you know the issue of immunization lies squarely on the shoulders of the National Primary Health Development Agency. So they are the ones that make policies, and I think this could be channeled to them so that they can look at it and see if that can help us in terms of coverage. Thank you.
Okay, thank you, Ma. Now the other question is saying, are you saying an infection by measles in an unvaccinated child can lead to an infection by chickenpox? Right, is someone who had taken varicella vaccine previously. Okay, I'm not sure I got the question completely, but do you understand what she's asking, Ma?
Well, I think I hope I got what he's saying. I think what I'm saying is that if you have had vaccination against chickenpox, some other diseases, and for instance, you did not take measles, and you suffer measles, is going to wipe out the memory that your system has against chickenpox, against yellow fever, against this and that, against even common respiratory diseases that maybe you've been exposed to and you've developed some memory against it. It's going to wipe out all that immune memory, such that you look like you are naive. You are like a newborn child who has never been exposed before. You've lost all your memory. So when it comes again, it's going to hit you hard, like you never had any immunity. So you have to start learning again, immune learning. Your immune system will start learning again. It will appear as if your first exposure, you suffer it hardly, you learn, so you have some memory again. So you are going to grow that over another 3 years. That's what's going to happen. Thank you. Are you with me?
All right. Thank you, Ma. That was okay. So the next question is, what is your view on the recent clinical trials that was concluded in Russia with reference to COVID-19 and the possibility of the third world countries getting access to vaccine?
Now, this is a major issue that is being considered by the global community. So there are global bodies now that are working, because there is a scrambling for vaccine is already happening, even before the vaccines come out. People are scrambling, they want to protect their own people, and the alarm is being sounded that if we just scramble for it this way, the developing countries are going to be at a disadvantage. So already there are global bodies that are working out to see how we can do this. Do we first give only people at risk? So we identify the health workers, the children, the elderly. Well, maybe not children even this time, because children are not so happy. But the elderly, and then the immunocompromised. And then how are we going to quota it so that if we don't have enough, using the quota, we make sure we get some to the developing countries. So this is already being considered as we speak now. So I believe that at the end of all the deliberations, a modality will be worked out. Even cost is an issue. So all of these are being considered. And even our own country is not left out. Our country, Nigeria, is also working on that. Thank you.
Okay, Ma. Thank you for that. All right, Chinyere Okonkwo is asking if COVID-19 disease can delete the memory of immune system.
Okay, it's a new disease, so we don't know much about the disease yet. You see, every day, new things keep coming out. We say it is this, tomorrow we discover that it is this.
All right.
So we're still on that. So as of now, in fact, what has been, we have some evidence to show that the non-specific effect I was talking about, that is the trained immunity, that is a vaccine, not only just protecting you against the targeted disease of that vaccine, but against other diseases. We have some evidence to show that something like BCG, especially live vaccines that are whole vaccines, actually have some protection against COVID-19. So it's still being studied, but the results we have so far show some linkage that BCG could have some protection, non-specific now, against COVID-19. So that's positive. Thank you.
Okay. All right. I'm going to come back to the Q&A group. Some people dropped some questions in the chat group, even though I advised them not to, but I decided to go through it again. All right. So somebody's asking that, what advice would you give people that were vaccinating institutions or corporate bodies and religious bodies before the lockdown, and they had to suspend the follow-up doses, say for cervical cancer or hepatitis B? Now, what would you advise them to do now that things have been opening up?
Okay.
Work is being again. Yes, ma'am.
Yeah, no problem. If you suspended any series, now that the lockdown is you simply continue from where you stopped. There's no need to go back or something. Just continue from where you stopped.
Okay. All right, ma'am. Okay, so somebody's asking that post-COVID states might come with outbreak of vaccine-preventable diseases. Are there plans and strategies in place to combat it?
That is it. That question is very relevant. And that is part of the plans, against, one of the plans that we have to plan for post-COVID, intensification. That is what we call it, post-COVID intensification, because we want to catch up again. You plan for catch-up campaigns. Apart from the routine vaccination, you plan campaigns to try and cover ground, lost ground as much as possible. So this is part of the plan, yes, because it's anticipated. Yeah.
All right, ma'am. Okay, so somebody's asking if there is any immunity for COVID-19 after being infected, and if yes, how long?
Yeah, that is a research question. And we still have conflicting results so far, but in terms of, we've had reports of people who suffered COVID-19 and then got reinfected. We also have reports of some level of COVID-19 mutations taking place. And we also have reports of herd immunity. Some have reported about 20% herd immunity already developed, but others have reported that we have up to 60% herd immunity in some communities. So it's still unfolding. But what we know is that there is a level of immunity. You know, we also use convalescent serum to treat some people. So antibodies are actually generated, but we're still trying to find the correlates of protection, because it's not just enough that you have antibodies, but are they protective antibodies? Are they neutralizing antibodies? And that is actually what the vaccine development studies are out to answer. You know, most people are feeling that it is the spike protein, because you have a lot of antigens on that virus that will generate antibodies. But which of these is actually protective? So these are all research questions being attended to as we speak now.
Okay, thank you, Ma. This question, I'm sure you've answered it during your presentation, but I'm going to ask it again. Somebody's asking if it is safe for their child to go to the hospital for vaccination during this pandemic.
Certainly, it is safe as long as you observe the transmission prevention measures. Now, let me use this opportunity to say that generally, many Nigerians are not observing this thing. If all of us observe the mask thing, the face mask, the social distancing, the hand hygiene, the coughing and sneezing hygiene, I tell you, the transmission will drop. We have countries where almost 100% observance is, you know, is done, and transmission has stopped. So if I don't even achieve anything else, I hope I achieve that everyone listening will begin to observe and tell others to observe. So when you go to hospital and you observe all these, and now we've said that when you are vaccinating, we've told health workers, do no harm. So while you are vaccinating to prevent other diseases, don't transmit COVID. And you do that by putting your mask on properly, not on your chin, okay, or your head. Cover your nose, don't touch your eyes, wash your hands frequently, or sanitize where you don't have soap and water available, and you keep your distance, and you observe cough and sneezing hygiene. Certainly you can break this transmission.
Okay, Ma. All right, somebody's asking for more information on immune amnesia.
Good. Maybe I can explain it again. You know, when some people have maybe something like stroke, you know, in adults, you see they have loss of memory. That is called, loss of memory is called amnesia. Okay, that's just the medical term. So you lose memory, and the person cannot recognize your face anymore, because where it was recorded that this is the face of his wife has been wiped out, has been deleted. Just like in the computer, you delete everything in the computer, nothing in the memory. So in our body, we also have what we call immune memory. And immune memory simply means that the soldiers of your body that fight infection, when you are attacked or infected, and they finish fighting it, they keep a memory of that disease. They store it away somewhere, so that when that same disease comes up again, they activate that memory and quickly generate soldiers to go quickly and quench that disease right away, based on the past memory. And so you may not even suffer the disease at all. And this is actually what vaccination does. So what we mean is that it's been found out that when you suffer measles and you survive, because some people die, others have complications. But assuming you didn't die, not you anyway, and you didn't have the complications, and you survived. The other thing is not just that you survive, your memory for diseases did not survive. Measles will go and delete every memory of your encounter with past infections. So when those infections come again after you recover from measles, you discover that you suffer diseases more frequently. Somebody that a measles survivor suffers other diseases more frequently than a non-measles, another child that did not have measles. Because the memory you had that will help you fight any disease has been wiped out. So you are just like a newborn who is fresh and has not had memory of any disease. So when that disease comes, it hits you hard. And you have to start all over again like a newborn to start developing your memory again. That's what we mean by long-lasting immune amnesia caused by measles. So in the opposite, if you now have like COVID-19, dropping immunization coverage, and so people who should have received measles vaccine are not getting it, and so they suffer measles, you have measles outbreak, it is not just that they will suffer measles, but they will also have immune amnesia, and they will suffer so many other diseases. So the impact is enormous. Thank
you. Okay. All right, there's some of the questions. I'm trying to skip through some of the questions that have been answered. Some of us are asking similar questions. So I'll just, so if I don't take a question, that means Prof has answered it while answering other people's questions, okay? All right, so somebody's asking if there's anything the government is doing to provide PPE for healthcare workers to avert their fears so that childhood immunization will go on without disruption.
Yeah, I said so in one of my slides where I said what has happened so far. This thing hit us suddenly, so nobody was ready. So, but over the month now, where the government is gaining back itself, so there are now more PPEs being provided, is one of the things I highlighted. So those sites that initially didn't have PPEs, a number of them are now saying that they have PPEs now. Yes.
Over. Okay. All right. So somebody's saying that a lot of pharmacies are afraid of creating awareness for vaccines in their pharmacy. And I think it has to do with something with their pharmacy council. So I'm not sure if Prof is in the right position to answer this since it has to do with PCN, but it's asking if their fear is valid.
Well, I don't know what it is that the council said, but I believe every pharmacy council should promote vaccination. And the awareness in the first place. Let's create the awareness. Then the issue of whether it should be done at a pharmacy shop, I have said that belongs to the policymakers. But every one of us, whoever you are, even if you're a market woman or you are a businessman, all of us should promote vaccination so that we can interrupt disease transmission. Thank you.
Okay, Prof, this conversation about immune amnesia is a lot of questions are coming from it. So I'll try to summarize most of the questions I've seen into one. All right, so I'll be asking all of them together now. So it said, in view of the immune amnesia induced as a result of contracting measles. Okay, so the first one I saw earlier, somebody wants to know if it is only measles that can cause immune amnesia. All right, so once somebody has the immune amnesia, that was the way forward. Will the person have to revaccinate all over again? Okay, so let's combine two together.
Okay, this immune amnesia was only an aside, but it seemed to be generated. I was just trying to use it to tell us that the impact of not immunizing, and that when we drop in our immunization coverage, that the impact is beyond just that disease that you are immunizing for. And there are some other vaccines that also have non-specific effects. So like you immunize for pneumonia, a particular type of pneumonia, and it protects you against some others. So when you don't immunize, you are not only exposing to that particular antigen, but to all other antigens that you would have been protected out of the non-specific effects of that vaccine. That's just the point I was trying to make. So it's not yet a policy that when you have measles, you should go and get immunization for everything. If that becomes a policy tomorrow, that's okay. But I guess you can take your boosters. And in our country, our policy is that even if you have measles, you should still get vaccinated. Yes, that is our policy. That's if you have not been vaccinated and you have measles. And the reason is not that measles does not give you immunity, but because there are other viral exanthems that can give you rashes that are similar to measles. And except you confirm that the rash you had was from measles in the land, you may not be sure. It could have been rubella, it could have been any other viral illness, and you called it measles. So based on that, we still immunize children, even if they had measles in quotes, because it's not lab verified. So that's what I can say.
Okay, ma. Okay, ma. So I'm going to combine two questions in one. And somebody, I personally would like you to address this. Somebody is still asking about safety. How safe is vaccines? All right. How safe are vaccines? All right. Vaccine safety. One question like that is there. And then somebody else is asking what is the possible relationship between BCG vaccination and COVID-19 infection? So
okay.
I think them around vaccine.
You know, the problem about vaccination is usually the safety. People are worried about safety. And people are so worried about safety because this is preventive. When people are sick and on their bed, and they don't even care about safety of any drug, they just want you to give them drugs so that they can recover. But because you give vaccine to healthy people, any little problem with safety is, you know, is heightened and escalated. And the vaccine community is aware of that. That's why it's often said that vaccine success, you know, that vaccine is its own victim. Because people are vaccinated, people are no longer falling sick. So if you now vaccinate and somebody has a little headache from the vaccine, is escalated, they say, this vaccine gave me headache, I don't want it anymore. This is because you are healthy from several vaccinations. So you even have time to consider headache as an issue. If you had the full-blown disease, you'll be crying for anything. So that's being said, there is actually nothing that does not have a safety concern. Even paracetamol that you take can damage your liver. Yet we take paracetamol anyhow, even more than vaccine. So most vaccines that are licensed for use, you must show rigorously that it is safe. If you don't show that, it will not even be licensed in the first place. But that is not to say that you may not have some adverse events that could happen. But that will be rare, and you will be told that this could happen. Maybe 1 in 100 million, you can have one adverse event, but you wouldn't, because of that, throw away the vaccine. Because most of the drugs we take all have terrible side effects, and yet we take them. Not to talk of vaccine, if you compare the adverse events of drugs to that of vaccine is so infinitesimal, so small. So we agree, you must prove that your vaccine is safe. That is primary. And then if there are certain safety issues, these are also highlighted. And the health workers will also let you know, like the pentavalent vaccine, you are going to have some mild fever, or you have pain at the site of injection. You may have some redness over 2 days, it will be clear. You know, some of these adverse events actually show that your immune system is responding to the antigen you were given. And that is why you are having the mild fever. But you cannot compare it to the actual disease itself. I think I can stop here. Safety is a whole lot to talk about.
Yeah. It's quite clear, ma. It's quite clear, ma. Okay, so an anonymous attendee asked how they can get Emzor vaccines in Asaba. All right, let me quickly address that. Please make yourself anonymous. You can private chat me, send me a message privately. I would respond to that. Okay, so that we can answer other questions. Please make yourself anonymous. All right, Angela is asking. Okay, so recently I read that experts at the University College London says that COVID-19 could cause neurological complications, including stroke, nerve damage, and potentially fatal brain inflammation. How true is this?
Just like I said before, this COVID-19 is actually a multi-system infection. It's every day we are unfolding other ways of manifestation. The clinical signs are expanding, and it's still undergoing studies. Like recently, we found out the multi-system inflammatory manifestation in children. So virtually every organ or every tissue could actually be affected, especially after scientists uncovered the microvascular angiopathic method of the infection. And you have vessels everywhere. You have vessels in the brain. You have vessels in the lungs. It's actually the vessels that are affected. So it's actually manifesting every day. So why not? It can affect the brain. It can affect the kidneys. It can affect the liver. It can affect the lungs. Practically every part of the body can be affected. Thank you.
Okay, ma'am. All right, so, okay, this might be important. So are there particular adult vaccines that should be given at this period? For example, influenza or PCV13. Just asking that this period of COVID-19, are there particular adult vaccines that we should pay attention to?
I actually feel that whatever vaccine you can get, you should get it. And we know that COVID-19 has to do with comorbidities. So if you can, prevent every possible comorbidity, that keeps you at an advantage. And actually talking about influenza, we know that we are entering the season, even though for Nigeria, we are almost perennial, all through the year. But for some others, either northern or southern hemispheres, at least for the northern hemisphere, the season is approaching. So if you can get vaccinated against influenza, that will give you an advantage. And now you know that influenza is respiratory and COVID is mostly respiratory as well. So to avoid comorbidities, we haven't known how the two will interact yet because we're just approaching the season. We don't know if the mitigation measures for COVID will likely reduce the spread of influenza as well because it's still the same mitigation measures, or if there's going to be a disease enhancement when the two come together. So why not, if you can vaccinate yourself, take the vaccine and reduce your comorbidity. Thank you.
Okay, Irma, as we are rounding up the question and answers, okay, somebody is asking, is there any reason why COVID-19 is majorly asymptomatic in children? All right.
Okay.
And the other question is related to the children, saying, what are the index of suspicion in a child presenting at emergency section?
Well, it's been observed generally, and in fact globally, that children are less affected. It is not just that they are asymptomatic, but they are also less vulnerable. So many children are actually not infected in the first place. Because sometimes people think that many children are infected, it's just that they are asymptomatic. But studies have also shown recently that children are not as infected as the adult population. Then when you come to the population of the children that are affected, majority are also asymptomatic. As for the reason, it's still under study, because ideally, children are a kind of, they have a kind of natural immune compromise, if you want to say it that way. They're kind of physiological. So they should actually be prone to the disease. So why they do not display symptoms often is still a research question that is under study. But that is not to say that some children do not actually come down with the disease. They do. And they actually manifest in all kinds of funny presentations. Sometimes it's just a skin presentation. So we're still kind of globally, we are documenting these symptoms and, making a kind of a catalog so that we can come up with a list of what you can see and suspect. Otherwise, what we do now is to have a high index of suspicion. And we are trying to see if this testing can be routinely available so that we can always test. If we have a simpler, people are working on simpler testing methods so that even people can test themselves. I think that's one major way to get this going. It's a major way of progress. So that's where we are. It's an unfolding disease. Thank you.
Okay, Ma. Okay, so I'm sure most of us have heard our questions being answered, okay, by Doctor. Okay, so just this one that is general is asking if we should allow our children go back to school if they are fully immunized against all other diseases.
That is a policy issue that is left for the government to make. We have government bodies that are issuing policies on levels of easing of lockdown. And so, they wanted to ease and get school started, and then it was withdrawn again. These are all based on data. As data come, either from our country or from other parts of the world, we use evidence to review the policies. So government feels that at this point, we should still hold on based on what we are seeing, number of cases, and then, people are feeling that these children, even though they do not manifest the disease most of the time, but they can then transmit it to the vulnerable adult population so that this may escalate. So we're still watching, and some other countries have allowed some of their children to go to school. We are watching them to see what happens. In some other countries, they allow them go, it surged, and they sent them back. So we are looking at situations, looking at data, looking at evidence, and that is what informs decisions. So as for schools, it is the government that makes that pronouncement, and they do that based on evidence. So we wait for them. Thank you.
Okay, all right, so this is for all of us. Somebody's asking if we will have access to your slide after this presentation, Ma.
Okay, you answer that.
Okay, so we'll try and make that available. After everything, I would make a Google form available for us to click. Those that are interested in having the slides, all right, you just fill in the Google form, fill in your details, your email address, all of that. We'll try and make that available to you. Okay. Okay, so all right, she has answered most of the questions. If I've not taken your question personally, that's because the answers have come from the ones that she's answered earlier. All right. Okay, thank you, Professor. We appreciate your time. We appreciate you sharing your wealth of knowledge with us, and then we're looking forward to more impacting sessions like this. I hope in the future when we invite you, you will oblige us.
Thank you. Thank you for the opportunity, and I want to thank all those who participated. Thank you.
Okay, ma'am. Okay, so hello everyone. I will quickly want to chip this in now that we've learned from Professor, and then we've seen that we still need to continue to create awareness about vaccine preventable diseases. All right, this is not the time to slow down, as we do not want to take any risk of having future outbreaks of already known infections. All right, so in light of this, World Hepatitis Day is about 2 weeks away. It is July 28th, and Emzor Vaccines is making every form of support available for hospitals, teaching hospitals, private hospitals, pharmacy shops, and individuals that have plans for World Hepatitis Day. So in light of this, we are committing ourselves to making sure that you have the test kits to make this screening possible, and every other things that you need to carry out this screening and vaccination. And we will encourage everyone to get in touch with Emzor vaccine rep that is in your territory. All right, and if you don't know who to get in touch with, I'm going to put my number in the chat box now. You are permitted to bombard me. It's all right. I would be able to link you up with the person that is in your territory that can that will be able to get those materials across to you. So please take advantage of this. If you see my shirt, all right, we said COVID-19 is caused by one virus, all right, but there are others. So we need to continue to create awareness about vaccine preventable diseases, and we, as our own part, we are playing our own part in making all of the necessary materials that we need is our hepatitis B awareness month. So, all right, I mean gloves, syringes, nose masks, and sanitizers, because we know we need to keep safe this period. We are making those available too, so that everybody working during this period is safe. All right, and test kits. So please get in touch with me. I'm putting my number in the chat box right now. Okay. Just send me a WhatsApp message, all right? And you once I find out where you are reaching me from, I'll be able to, give you the contact of the Emzor vaccine rep in that location, and they'll be able to help you sort out and prepare for World Hepatitis Day program. All right. So we are thankful for everyone that joined us today. It's been a very impactful session. I'm going to put up a link to. I'm going to put up a link in the chat group. I'm doing that right away. Okay, please copy the link, all right, and follow it to, it's a Google form link, all right. If you want the presentation that we just had today, if you want the slides, please fill in that link, all right. You will get your information from there. It's just asking for your phone number, your email address. So we'll forward the slides to you later on. So if you're interested in having the slides, please, the link is in the box already. My number is in the box already too. So please get across to us, and then we'll make sure that all the information that you need is made available. All right. So thank you very much, everybody, for being here today. We appreciate your time. We appreciate it's a collaborative effort. Okay, so people are raising their hands. Okay, so I'm just quickly going to, if you're raising your hand, please ask your questions. Ask your questions in the question and answer group, please. Please, if I raise those, Abiola Paul, Ozie, Uwari Y9, please ask your questions in the question and answer group. And if we can't take that now, my WhatsApp number is already up. Please buzz me on WhatsApp. I will attend to you, because I'm trying to see if somebody is saying something at the question and answer group, and nobody. Professor, by the way, responses, feedbacks have been coming, and people are saying it's a fantastic presentation. All right, I'm sure if you scroll through the chat and to the question and answer group, people really appreciate the body of knowledge. I've learned a couple of new things too today. Okay.
Yeah, thank you. I've seen one question here. Somebody said, explain why herd immunity is reduced. Yeah, okay. I said herd immunity, of course, when you stop vaccinating now, you're going to reduce herd immunity, because herd immunity is a function of percentage of the population that are vaccinated. Okay, so if you need like 90% for you to really achieve herd immunity for like measles, or 95, and because of the pandemic, people are no longer vaccinating, and your coverage drops to 80 or 75, certainly your herd immunity is going to reduce. So herd immunity is reducing because people are not vaccinating. And so that level that you require to interrupt transmission, you've gone below the threshold. And so you have outbreaks. That's how it works. Thank you.
Okay. All right, Professor, Taiwo Popola, okay, he has asked this question. He is saying that with COVID-19, everybody has been talking about the negative impact. All right. So he's saying that, does that mean that there's no positive effect of COVID-19? That what are the positives that we can take away from COVID-19?
Yeah, I like his approach, because everything that has negative has positive as well. Yeah, the positive effect is that we have learned a lot of lessons because I think the last thing I said in my, was in my summary or something, is that we should learn to immunize health services against disruptions. Okay, when we have an outbreak or a pandemic like this, we should not just, go flat. So we should put policies in place on how we should handle outbreaks like this, so that anytime we have such a thing happening, we are not taking unawares, we lose our ground before we recover. And another thing is that it has also heightened our knowledge of hygiene and disease prevention, especially diseases that are, transmitted, from person to person. So people are becoming more aware of hygiene now. People know they should wash their hands. We've been promoting hand washing for ages, but nobody has been taking it serious. So everybody now knows how to wash their hands. Hopefully, I hope everybody does, So these are some of the, and then this has also sparked of the scientific community globally in terms of research, within a space of, a short while, you've been able to sequence the virus, you've been able to even develop some vaccine candidates. So with all of this knowledge, we go back to diseases that have been troubling us all this while, and maybe we will not be able to have better vaccine candidates for such vaccine, such diseases like the HIV, the malaria, So certainly with time, we're going to be seeing some of the more positive effects of the COVID, I believe. Thank you.
Okay, thank you, Ma. I see, thank you for everybody for your feedback. The Google form I learned is taking just numbers. All right, so I've made some adjustments on it while Professor was talking, and I've pasted the link to the new one. So please take the new link is up now for the Google form. Please follow that. It's going to allow you to drop your email address. Thank you very much, guys. So we are going to leave the meeting on so that everybody can get a link, access to the link now. I've put up a new link, guys. So people are already reaching me via WhatsApp. Thank you. We are for our responses, for our feedback. This is a lively webinar. Everybody, the questions were flying in left, right, and center.